Hello, I'm Ann Riley, and I'm delighted that you've joined us today for this review of the activity we're asking the expert advisors to carry out. This is part of the National Children's Study Health Measurement Network. We've developed a health typology, and we're asking you to help us evaluate. The Health Typology project has been going on for the past year, and we're asking experts to apply it now to see how useful it can be in understanding the impacts of specific diseases or environmental exposures. You'll have access to online materials, and we'll talk about a timeline. We want you to know that if you need to, we'll be available to you at any time in your review, and we particularly want you to know how much we appreciate the work that you're signing on to do. The objectives of the Health Typology project were to describe health at the level of the whole person using standardized terms and nomenclature, and create a theoretically based framework that would then support the development of health measures, multiple modes, different types of health measures that will be important for longitudinal research. We think that the typology will help us prioritize the health concepts that are most important to be measured across the 21 years of the National Children's Study, and will help us do a gap analysis to see which measures we have and where the gaps are in the measurement armamentarium that we currently have. This will help us support measurement of the same concepts across the lifespan. They certainly will change somewhat in terms of the content of those instruments, but the same concepts can be measured across the lifespan. The health typology is based on a theory of health that is being shared with you in the Health Measurement Network paper called What is Health? It's online and accessible to you. The typology translates this theoretical description of health into practical language and uses discrete categories, each that has a definition, to be able to organize and communicate all aspects of health at the person level, at the level that people experience the functions of health. The version we're working with right now, version 1.1, has 3 levels: the 5 health assets. Each of those have sub-assets at level 2, and each of those has sub-assets at level 3. There's a total of 85, and those are the ones we'll be asking you to review. When the health typology is finalized, it will guide how we measure health in the NCS as well as other studies. These are the 5 assets at level 1. They're the essential life functions of all living beings. The first is managing energy. All living organisms have to take in sources of energy, use it, and release it or dissipate it. Adaptability is a health asset that we're very familiar with. It's often what we think of when we talk about the health of a person. Being able to respond to the demands of the environment, maintain one's own integrity, and support the functions of the body to replace and regenerate itself while maintaining its structure, its essential integrity. Mind is an asset of all living beings. That is the ability to sense and process information, to make sense of it, in order to take advantage of one's place in the environment. Reproduction is obviously an essential aspect of living beings, providing the basis for new life, and extremely important in the National Children's Study. Capabilities are the functions, the life functions that allow us to acquire and apply skills within the context of our physical and social environments. So these are the essential functions of life, the core aspects of health. I wanted to show you one of the assets, adaptability, with its level 2 and level 3 assets included, so with these definitions. You can see that there are 3 slightly larger labels in terms of the font. Those are the three level 2 assets under adaptability: protective defenses, stress response, and restoration. Underneath each of those is the level 3 asset. So at level 2, you can see we're using codes that take just two letters, the first letter of the level 1 asset and the second letter is the second level. So AP is adaptability, protective defenses, AS is adaptability, stress response, and so on. And then below that, level 3 assets are numbered. This next slide is another view of the 5 aspects of health that are at level 1, and then each of the level 2 health assets. And so at level 2, you can see there are 19 different health assets. And then when we go to just one of the assets, so we can break it out to the level 3, you can see for capabilities, you've got movement, self-care, communication, and interpersonal capabilities, and each one of them is split into sub-assets. So we're getting to the point at level 3 of measurement. There are such things as maintaining relationships, forming relationships, dexterity, body positioning. These are concepts that are pretty amenable to measurement. But we think that we probably need to go to a 4th level, which isn't specified for most of the assets yet. But we've done that here for sleep. So you can see sleep is part of an adaptive response, part of the restoration processes that are essential to health. And we've split out so that we might talk about the quality of sleep, the wakefulness, nature of wakefulness and the quality of wakefulness, as well as sleep continuity. And so these are really much closer to the subscales that you might be interested in measuring if you were going to measure sleep. Let's talk about what's not included in the typology. First of all, the outcomes of health, the things that health allows us to do, the life plans and functions that we engage in, that these are not health per se and are therefore not included in the typology. Extrinsic health influences, such as environmental influences that some of you will be applying to the typology, are also separate from health, even though they certainly need to be measured in the National Children's Study. The intrinsic health influences are very important, sort of a substrate of health. They're not at the person level, however. So cell tissues, structures, systems, and the body structures are not part of the typology, despite their importance to health. Okay, you're going to make a contribution to the measurement of health, and your task is to evaluate how useful the typology is by reviewing the 85 health assets at level 3 and identifying how likely each one is to be affected by the disease or exposure that you've chosen. You'll be rating how much of an impact that disease or exposure has on the health asset. We'll give you a chance to comment on your understanding of the level 2 health assets. That's where the comment box is. But of course, it's a free text box. You can say as much as you want about the other levels. But level 2 has 19 components, health assets, so it's more manageable in terms of commenting. You may also, of course, as we mentioned, want to specify the age range, gender, and specifics about the disease or exposure in order to narrow the focus of your analysis and make it a little simpler and a little more precise. To get started, you'll go to the online resource via a link that is right here that you can just connect to. And you'll see 3 or 4 files there. What is Health is a paper that you'll have access to, a PDF version. And there's also an accompanying PowerPoint presentation that Chris Forrest has done. He's the author of this paper, and although the paper is much more in-depth, the PowerPoint presentation will certainly give you a good idea about the background and the theoretical basis of health. The Typology 1.1, you saw a little bit of that. The adaptability asset is also a file on this link that you'll want to take a good look at. And you'll have the definitions at each level of the typology. There's an evaluation form. It allows you to complete the background information on yourself about the disease or the exposure that you'll apply. As I said, the age, gender, other specifics that you might want to use to narrow down your focus, and then rating the impact, the likelihood and the impact of the disease on the asset, and make comments. We're hoping that by June 29th you can do your evaluation and upload it so that by the first week in July we'll be able to put all of the evaluations together and constitute a series of focus groups that will be held on July 13th at the Natcher Center. That's the day after the National Children's Study Steering Committee meeting ends. That's Friday. And we're holding focus groups at either 9 o'clock in the morning or 1 p.m. And in order to have them focused on a particular disease or a particular exposure, we're going to have to invite people. And most of the groups will have 6 groups that will be focused on a particular disease or exposure, and they'll be happening at a particular time. So we'll have to invite you if you're interested in participating in those. And for those of you who are focused on a disease or exposure that is not common and not analyzed by a large number of people for a focus group, we will have one group at each time that will be meeting about the typology generally, even though people will have rated a number of different diseases or exposures. When we get all of that information, we're going to be putting it together with the analyses done by another group of experts that have been looking at the typology more generally, and then by September we expect to be able to summarize what we've learned and to have a revised typology of health well underway. And of course, we'll share all that with you. Your efforts will be a major part of our ability to understand how useful the typology is and ultimately how helpful it's going to be in the measurement of health for the National Children's Study. And once again, if you have any questions or problems, please don't hesitate to let us know. You can always contact Anna Huss. This is her email, and all of us will be basically accessible and get back to you as quickly as possible. Thank you so much for your attention, and we look forward to your analysis of the utility of the typology, and are looking forward to the focus groups and meeting many of you. Thanks.